I'm going to show my teeth. And so the end, I go, okay, and now the end. Would that be good?
I think that's what we want.
Okay.
How was your experience with the dentist? Did you find that?
I hate dentists. But I don't know about you, but I had periodontal problems many years.
Pain and abscesses.
Oh, it was terrible. And I used to go to the doctor every 4 months.
Okay.
I did.
I was very self-conscious about my teeth, and I tried not to smile where people would really see it too much. I just always hated my teeth. And once I had Dr. Coleman redo, he did all the front top teeth, I mean, it made a world of a difference. Yeah. Now I smile a real big smile, and no more self-consciousness. It's a pleasure.
So today we're actually filming this procedure, and you get to be the patient and the cinematographer. I get to be the doctor and the cinematographer. So we're multitasking. So John, let's just review a little bit in terms of your history as we look at this x-ray in front of us. And this is the reason specifically we can't put implants in the back, because the bone has resorbed so much, it's too close to the nerve. There's not enough height above the nerve to be able to put implants in. But in the front, we've got really good bone here, very dense bone, good height of bone. This is the ideal place in the lower jaw to place implants, and we've basically mapped out we're going to place 5 implants spread out in the lower, and the blue show the posts on which we're going to make a temporary bridge.
And before you had the work done, you looked, what, in your 80s?
About that, yeah. It was very depressing. You know, everybody said, oh, you look so old. What's happening to you?
And then you came back after seeing Dr. Coleman, and all of a sudden people were like, hey.
Yeah, it made a big difference.
Okay.
It really did, because I had work done before, and from a different dentist, and I guess he meant well. And it was better than what I had, but it really wasn't where it needed to be.
Okay.
So Dr. Coleman was recommended this many years ago now. It's a good 10 years we started.
Okay.
Work. We probably finished it all a few years back, but little by little, as the budget would allow.
That, very important.
And he was very nice. Dr. Coleman did work with us.
You know, I had a tremendous experience with him. I wouldn't go to any other dentist anywhere. You know, I think that he's says, you know, he's a great dentist. He's very particular. He's a perfectionist. And if he doesn't feel right about what he did for you, he won't let you walk away. He wants to make sure that's done right. And that's what I love about him. Besides the results, I got great results, you know. But my gut instinct told me that this was the place for me, and
you were right.
And I was right.
Yeah.
You know, I never changed.
Look at the smile. I mean, it's just unbelievable, right?
Yeah.
I think very highly of Dr. Coleman and his staff. I think they're very professional. I think they're very sincere in what they're doing. And I would highly recommend anyone having any kind of, considering any kind of dentistry work, to speak to Dr. Coleman.
Hereditary. Yeah, I know. All my sisters, I have 5 sisters, and we've all had issues with our teeth. But, you know, if you get it taken care of as soon as possible, rather than waiting, you know, you avoid a lot of more problems that would happen as time goes on.
Absolutely.
You know?
And it's an investment. It's, you know, a car is an expensive investment, or a new outfit or a new watch, but this is an investment that pays off all the time. You always have a smile with you, no matter where you go.
It's more important than anything you could purchase to drive in a car, a beautiful car. I would rather, I mean, everyone notices your smile. That's the first thing you notice about a person. And when you're not self-conscious and you just give a big smile, I mean, it opens up the world to you, you know?
So let me see you smile. Yeah, see that?
Yep, I have a big smile.
That's okay. The world needs people with more big smiles.
Yep. And I am very grateful to Dr. Coleman. He's done an amazing job.